What is up, everyone? Welcome back to another Take Me Back Tuesday episode. So this week I decided to replay the episode with my friend Tracy at Advanced Life Clinic on tattoo removal and CoolSculpting, mostly because a lot of y'all have noticed that my arm tattoo is almost gone, and it's been a year since we recorded this episode, and I've had a lot more questions on tattoo removal lately. So why not just bring this episode back so you can get all your questions answered by the expert herself, Miss Tracy at Advanced Life Clinic here in Huntsville. So if you're interested in tattoo removal or maybe even CoolSculpting, this is the episode for you. And don't worry, new episodes will be back in the next couple of weeks, guys. So I hope you enjoy this episode. If you've already listened, maybe listen again, get some new insights. And if you haven't listened, I hope you enjoy it for the first time. All right, here we go. Hi, Tracy. How are you?
I'm good. Thank you for having me.
Absolutely. I'm so excited to have you here because I've been dying to get you on the podcast. For those of you who don't know, if you don't follow me on Instagram or listen to the podcast, you know that I've talked about my laser tattoo eyebrow removal. I've never really spoken openly about my other tattoo removals, but Tracy has been the technician that has removed them from Advanced Life Clinic. So I wanted to have her on the podcast to educate all of us on tattoo removal, but also she does CoolSculpting at Advanced Life Clinic as well. So I was like, if we're coming over, you got a babysitter for your kids, left them with the husband, whatever you did today, then we're just going to do it all at one time.
Sounds good.
Okay. So we'll just dive into CoolSculpting first because I know nothing about CoolSculpting.
Sounds good.
CoolSculpting. And then we will just transition over into tattoo removal.
Okay.
So first and foremost, Tracy, how long have you been doing like laser technician, working at Advanced Life Clinic, doing all the things that you do at Advanced Life Clinic?
I have been with them for 6 years now.
And what all do you do there? Like, is it just tattoo removal and CoolSculpting, or do you do other stuff?
I do a little bit of everything. I do CoolSculpting, tattoo removal, TBT, which is skin tightening. We also do PicoFacials with the tattoo machine, and diamond glows.
Oh, yeah. So for those of you who don't know what a diamond glow is, to me, it's essentially the same thing as the hydrofacial.
Yes.
Is that what it's called?
Yes.
But you'd use a diamond tip instead of the... Because it does the same thing, right? Like it pulls the stuff out of the pores.
Yes, it is the only FDA-approved machine, though, that gets the serum down to the dermal epidermal junction. The hydrofacial may do that, but this one is FDA-approved, so it is proven that it does that.
Okay. Well, let's dive into CoolSculpting a little bit. So everyone, if you don't know, you've probably been living under a rock because I feel like CoolSculpting is like a thing. It's been around for a few years now. Do you know how long it's been around now?
I don't know exactly. I want to say about 15, roughly.
And then y'all just got it 4 years ago?
We got it about 5 years ago.
Okay.
Yeah.
So you've been doing CoolSculpting for about 5 years.
Yes.
Then. So how does this actually work? Like, how does it get rid of your fat per se? If that's...
Yeah, it does.
Is that what it does?
It does. It gets rid of the fat. So the process of freezing the fat is called cryolipolysis. So what we're doing is fat freezes at negative 11 degrees Celsius. So that's what the machine's doing. It is getting your fat down to that degree, to negative 11 degrees. So it only affects the fat. It doesn't affect the surrounding tissues or anything, and it freezes it. And when fat is frozen like that, it kills it. So once it's, killed, your body gets rid of it through your lymphatic system. It flushes it out.
So you use this little device and you put that on, like, I guess that area that someone's trying to lose fat in.
Right.
And that thing, the device part, the little suction cup or whatever it's called, gets down to a negative 11 degrees.
It does.
Oh my God, does that hurt?
No, not really. I mean, it can feel a little uncomfortable just when it first gets cold for the first 5 or 6 minutes. Imagine going outside in the snow and you know how your fingertips feel a little almost like burny, if that's a word. But that's kind of what it feels like for a few minutes. It doesn't really hurt. It can be a little uncomfortable. Some people don't even feel it. They're just like, it's cold. Then after that, it goes numb. You don't feel anything for like 30 minutes.
And does it actually work? Like, because, you know, you hear things that work and you're just like,
Trust me, if I hadn't have been doing this for 5 years, I would have said, it sounds gimmicky.
Yeah.
It really does, but it does work. I personally see the results. I have patients come back. I beg people, please come back to your 90-day follow-up. So I can show you your results. It absolutely does work.
Now, obviously it's not liposuction where you're just going to wake up tomorrow and it's going to be gone.
No.
So this is like a process. So you call them cycles?
Yes.
Where people come back, that's when people come back, they're like other appointments or cycles?
Well, cycles is the hand pieces that I place on you. Those are the cycles. So, I mean, sessions is the day you're there. So in one session, you may have 8 cycles done.
Oh, okay. I thought cycles were when they came back.
No, it's confusing. I know.
Yeah, okay.
I have this conversation
Sessions
frequently.
are appointments and cycles are the hand pieces.
Yes.
Okay. Got it. With it.
So we price it by hand pieces, by the cycles. You're priced by cycle. But sessions is just how many times you need to come back. And most people need 2 sessions.
Okay.
So people get confused. They're like, just 2 cycles? I'm like, no.
So most people you said need 2 sessions to get like rid of 5 pounds or?
It's not really getting rid of weight. That's a common thing. People come in and I'm like, it is not weight loss. So we're not getting rid of weight. What we are doing is getting rid of inches.
Okay. I'm with you now.
Yeah, I know. Some people are like, how are you getting rid of fat and you're not losing weight? And
well, subsequently you can lose weight, but it's probably not going to be a lot.
Not significant, no.
I would assume a device like this, like good candidates versus bad candidates,
you're not going to see great results.
Yeah, like
it's not that I can't do it. Ideally, you're going to be within 20 to 30 pounds of your goal weight.
Okay.
The closer you are to your goal weight, the better results you're going to see and it depends on what your goals are too. It's if you come in and you are further away from that, from your goal weight and you're wanting, if you're a size 10, you're telling me I want to be in a size 6, I can't do that. But if you come in and you're closer to your goal weight and you're like, hey, I've got a little bit of a muffin top, I just kind of want to smooth that down, that I can do. I mean, you got to have realistic expectations as well.
Okay. And so how many hand pieces or cycles can someone do at one time?
I can do up to 4 at once.
Okay.
If they're not competing tissue. For example, I could do each of your arms. I could do one maybe on the inner thigh and then one on your abdomen. I could hook all of those up at once and have all of those going. So it cuts down on the time that you have to be there.
Okay. That's good because everyone's like pressed for time these days.
Right.
And so what are all the locations that you can actually CoolSculpt?
So basically, I'll name them all, but it's from chin to knees. So you can do the submental area right under the chin. You can do the bra fat right on the front, that little pudge you get when you put your arms down. You can do the abdomen, upper and lower abdomen. You can do the flanks or the love handles, as some people call it, bra fat on the back on your back. You can do the back of the arms. You can do right above the knees. You can do inner thighs, outer thighs, and what we call the banana roll, which is that little pocket of fat right below your butt.
Oh, I need that. That's what I need.
I do that sometimes.
I'm just like, oh, that's good. But when we talked a minute ago about like good candidates versus bad candidates, how do you know if someone I know I came to you before, not recently, guys, but like before, like when I had a little bit more fat, and I was like, Tracy, do you think we could CoolSculpt this? And you were like, no.
And well, that's a great question. The people who are going to be better candidates have subcutaneous fat. So the fat, it has to be pinchable. That's the easiest way to put it. If you can pinch it, like a good amount of it, then yes. And some people come to me and they're like, look at this. And they're like, they pinch this tiny little piece. And I'm like, no. And it can't be skin. I know a lot of people, they'll do that. And it's just excess skin. And so it has to be the subcutaneous fat.
Okay. Is there any like adverse reactions that a person can have? Like, can this stuff, since it's negative 11 degrees, freezer burn you, if you will?
No, because I know people come in and they're like, why can't I just go fill up my bathtub with ice and just do it that way? And I'm like, well.
Because you're going to get hypothermic.
Yes, and it's going to burn your skin. So no, we do take precautions. We do a pre-treatment wipe and a gel pad that goes over your skin before I place the handpiece on. And that protects your skin, but also because we're targeting that fat at negative 11 degrees Celsius, it is only targeting that fat. It doesn't affect tissue, organs, anything surrounding it or your skin. Good. So it's safe.
Now, can you get with liposuction, you can get if they don't go in the same area of fat, you can get misshapen liposuction. Can that happen with CoolSculpting?
You can get misshapen areas if you don't have somebody that knows what they're doing. And I've had people, ask me, they were good candidates, but I didn't think what I was going to do would leave them looking the way that they wanted. And I've told them, personally, I wouldn't do this. But yeah, you can have what we call shark bite effect. And that is for example, I would never CoolSculpt on somebody's butt, but I've had people ask, and I'm like, I can't because I can't fit it over the whole thing.
Right.
And it can like cause an indentation. So
how does the abdomen work then so you don't get it like indented, if you will?
So what I do is I place the hand pieces, I overlap them. Well, one at a time, I put the hand pieces on your stomach, and then when I take that off and put another one, I'm overlapping the area that I've already treated. So I'm treating the whole abdomen or the area.
That makes sense. Okay.
Yeah. And it does have like a feathering effect. So it's not just going to be, you're not just going to see an outline of the applicators on your stomach that's like smaller and the rest of it's bigger.
Okay.
It does feather out.
Well, that's good to know.
Yes.
Because I'm sitting here thinking like, it's this little suction cup.
It's just going to be in that shape. Yes.
Right.
I've had people ask, they're like, is it just going to be in that shape? And I'm like, no, that would look weird.
And you said it does not hurt, cannot cause freezer burn on your skin.
No.
And so how many cycles would you say, I know you said you can't base it on weight. Can you base cycles on inches? Like if someone comes in and says, I would really like to lose 2 inches. Can you estimate, or is like everyone so different? It's kind of like you're just like,
Right. Everybody's so different. I really can't.
Okay.
But what I do encourage people to do is like, for example, I have women come in all the time who they want the back of their arms done. And they're like, I don't wear short sleeves anymore because I hate the way my arms look. So I tell them, after they're done CoolSculpting, go home, find a shirt that it's a little snug on your arms. You don't quite like the way it looks. And when you're completely done, go put that same shirt back on. You're going to see that difference. Or in their pants, if you have a little muffin top, go put those pants back on. When you're done, you're going to see that difference.
I know exactly what you're talking about, because when I was doing a little bit of nutrition coaching, it was really hard to get people to see it because like I did before and after pictures with my clients.
Yes.
And obviously a third party who has no emotional tie to someone else's weight, it's so much easier for us to see it.
Yes.
And especially when you're not seeing them every single day. Like if you're the person trying to have this procedure, you see yourself every day. So you're like, nothing's changing. I look the same.
Yes.
And I couldn't get my clients to like want to stay off the scale versus doing measurements. And I was like, so that is something I'd be like, we're going to measure our waist, our hips, our breast area, and see what inches we're losing. Because sometimes you're just replacing things, and so I mentally know. So maybe for the people listening, if they're more into like a fitness journey, you can think about it like that when you're trying to get your clients to get off the scale and measure themselves, because you're like, oh my God, this number don't matter.
Fun story is I had a lady and her husband come in, and they were both bodybuilders, and they just wanted to, they had, very little, trust me, they were in great shape, but they had very little. I think the husband wanted to do a little on his lower abdomen. The wife wanted to do some on her flanks just to shave a little bit down before competition. So we did the 2 sessions on both of them, and then I had them come back in 90 days, and I took their pictures, and before I showed them their pictures, I said, what do you guys think? Are you happy with your CoolSculpting? And the husband said, I love the CoolSculpting. I would do this again. It worked great. The wife goes, Tracy, I don't think it worked. It's not for me. I don't think I would ever do this again. I said, okay, that's fair. Let's look at your pictures. I showed her pictures, and they were incredible. We actually used her pictures. She let us use them to show her before and afters because she had such good results. But she was so used to seeing herself every day.
And I think women are more critical than men on themselves anyways. Like maybe I'm wrong, but that's just... Or maybe women are more open about it, I guess.
We are more critical. We are our own worst critics. But had she not come back and looked at her pictures, she would have walked away thinking, this does not work. It is, CoolSculpting doesn't work. I didn't have any results. But she had great results. And as soon as she saw them, she was like, wow, I want to sign up for another body part. And she signed up that day to do more.
Okay. So at least she got her before and after.
Yes, it's super important to come back because you're right. You see yourself every day, and you might not realize what good results you've got.
And that's the only way I can make my brain wrap around it is when I was coaching my clients. Like if they were with me for 3 months, let's say they paid for 3 months. Yeah. At the end of the 3 months, they were like, I didn't lose any weight. And I'm like, what are you talking about? You lost 15 pounds in 6 inches. And they're like, what? I'm like, yes.
Yes. But you get so used to seeing yourself every day. And this is a slow process. It does take up to 3 months past your final session. And like I said, most people need 2 sessions, but that doesn't mean that's all you'll need. Some people do 2 sessions, and that's perfect. Some people do 4 sessions on an area before they get their desired results. And then it takes another 3 months past that to see your final results, your maximum peak results.
Why does it take so long? So it takes 90 days to...
past your final session.
Okay.
Because when we freeze the fat, all the fat cells don't die immediately, but they are injured beyond repair. So they do slowly die off, and everybody's different. Your lymphatic system takes different, amounts of time. Like some people may flush it out quickly. Other people, it may take the full 3 months before they see that result. I had a lady in the other day, she said the first 2 months, she didn't really see a big change, but that last month, before she came back in, she said it just kind of disappeared, fell off.
Now, is this a permanent thing, or can the fat come back?
It is permanent. So when we're adolescents, we have all the fat cells our body is ever going to have. So when we kill them through CoolSculpting, they have no way to come back. So it is permanent.
Other than they can go to other areas where you still have fat cells. That's what they say about liposuction anyways. I'm just making this up, so I'm asking. It's a question. But like I've heard like liposuction, like when someone gets, like say you liposuction the lower abdomen.
Okay.
The fat will not come back to the lower abdomen, but if you do overly eat, except like, over your calories or whatever, calories in, calories out, that it would go somewhere else, like maybe your butt or your flanks, and it would go to a different area that still had the fat cells to grow.
That is true.
Okay.
So because people say, well, can I still gain weight in this area? You can still gain. For example, let's say we do CoolSculpting on your abdomen. You can still gain weight in your abdomen. You may not gain it as quickly because you don't have as many fat cells there. You may not see that as quickly, but you can still gain weight. But you're right. You're going to see it in the other areas quicker,
right?
Because they have not had
so
treatment
it's similar it's similar to liposuction,
right?
Would you say this is a good idea for someone who? Because clearly liposuction is very barbaric. If no one has ever watched this shit online, it's rough. It's rough. But they also like talk about going through the different layers, and that gives the rippling effect and stuff. So would you say like someone who's going in, like the athletic people that you talked about, maybe has very little fat, would you say CoolSculpting is way less like downtime, invasive, things like? Is there any downtime at all with CoolSculpting?
No, there's not. I mean, I can tell you the side effects, but I've literally had people get out of my chair for CoolSculpting and say, hey, I'm going to go work out at the gym. I'm like, go for it. You are going to be sore to the touch, not walking around hurting, but like if you pushed on your abdomen after treatment, it's going to feel a little sore like you did a bunch of sit-ups. So you are going to feel sore to the touch anywhere from 1 to 3 weeks after. So,
that makes sense.
It depends on your level of tolerance, but there's no downtime. It's not going to keep you from going to work. It's not going to keep you from working out.
You don't have to wear compressive garments.
No.
Okay.
You don't have to do any of that stuff. And nothing you do at home is going to reverse it. I've had people say, what if I go get in a hot tub? I'm like, you can.
So, am I going to just warm this up real fast?
Well, I mean, that's been a question. Like, what if I put a heating pad or get in a hot tub? I'm like, you can't do anything to reverse it.
You just went to negative 11 degrees.
Yeah, they're dying. They're gone.
They're gone. They're dead. We killed them.
Right.
All right. So last but not least for CoolSculpting, and then we'll move on to not laser hair. Why did I just say that? Laser tattoo removal.
Yeah.
Is the cost.
Okay. So
that's obviously the biggest question I had when I did our little poll on Instagram was, what is the cost of this?
So where I work at Advanced Life Clinic, now normal cost is $700 per cycle. I know that's a little bit much because most people need more. So I do have a little leeway. So I do it for $500 per cycle. Up until you get to 8 cycles. If you need 8 cycles or more, I will drop that cost down to $400 per cycle.
That's good.
Yeah, I think that's fantastic, honestly.
But y'all also run specials throughout the year.
Yes.
Do you know when like your biggest, do you have one big one for the year that maybe people, if they're thinking about doing this, can save up for?
Yes. Usually we do our open house twice a year, once in April and once in November. So we always have sales at those 2 times. And don't get me wrong, sometimes throughout the year we may have like...
Y'all have monthly specials and stuff.
We have monthly specials, not always CoolSculpting, but like in April we did Cool Month where it was buy 4 cycles, get 4 free.
4
cycles.
I thought you were about to just say 1. I was like, okay, well that's still good. That's a still good amount.
And it wasn't our sale. It was Allergan who owns CoolSculpting. It was their sale, but they allowed us to do that, and it was so successful. They extended it into May. So for 2 months, we had if you bought 4 cycles, you got 4 free, and I have never seen a deal like that.
Right. So if you charge $500, 5 times 4 is $2,000.
Yes.
So you would get an additional $2,000 free. Instead of like a buy one, get one free deal.
Yeah.
Why would you not?
Exactly. I told people if you're looking for CoolSculpting, now is the time to get it. And no, we don't always have that, but we do have sales at least in our April and November. And if you just, on our social media, if you're, Facebook, Instagram, you'll see when it comes up again if we're having like a monthly sale or something.
Right. All right. So that I don't have any more questions about
Okay.
CoolSculpting. That was mostly the ones from Instagram because I don't know anything about CoolSculpting other than I've joked around with you a few times and been like, so.
And I will say this, a lot of people, they think that someone who is smaller or bigger is a candidate or is not a candidate. I have to do a physical assessment.
Right.
Like people go, well, just look at me. I've literally looked at someone and thought, going to be a good candidate. They're too small, but they were. Not that they needed much, but they were a candidate. And I've also looked at somebody and thought, they're going to be a great candidate, and they were not.
Right.
So do come in,
and the consults are free.
Consults are absolutely free. If you want to go home and think about it, you can. You don't owe me anything.
Well, that's good. I like that approach because it's not very salesy, Like,
No.
I just don't like when someone's, be like, oh, well, you got to do it today.
I will not do that because I want, if you choose me, if you come to me, whether it's for tattoo removal, CoolSculpting or anything, I want you to be comfortable and know that I'm knowledgeable in what I'm doing and, you're comfortable with me. I want you to choose me because that's the right decision for you.
And you've had some amazing, successful.
Absolutely
I've
amazing.
seen your before and after pictures. They're amazing.
Oh, yeah.
I'm just like, this is actually like legit. I thought, again, like you said, when we first started, it does sound a little gimmicky when you're talking about it, but then you're like,
I've seen results like personal, like in the stuff you see that I show you, those are people that I've done in office. Like those are not stock photos I've pulled off the internet. They're my pictures, whether it's tattoo, CoolSculpting, those are my pictures.
Which I appreciate.
Yes.
So what we're going to get into, what everyone's been waiting for, is the laser tattoo removal. Did I say that? Yeah. I was like, did I say that right? Laser tattoo removal, because you have, so for those of you who don't know, I've known Tracy since she began at Advanced Life Clinic.
Yes.
I think I started maybe 3 months prior to her when I worked for Dr. DeGraff back in the day when she was doing some concierge medicine. And I've remained friends with Dr. DeGraff and it's been wonderful. But Tracy started working there when I was already working there, and I had 2 tattoos that I didn't really care for. And I remember Dr. DeGraff talking to Tracy about training on the laser tattoo removal. And I was like, sure, let's just try this.
Right.
Let's just, I don't really care for these. Let's go ahead and get rid of them. So I was the guinea pig and Tracy got to practice on me, but
Thank
she was
you for that.
But you were already good. You were already good at it anyways. And I personally, my personal opinion, because I had been going to another clinic here in town prior to you starting practicing it on one.
Right.
I think I've had maybe 5 or 6 sessions at that clinic and it literally was not fading. It was the most painful thing. We used only topical lidocaine cream. It was not fading. And then when me and you obviously were working for Dr. DeGraff, I was like, sure, I'll be the guinea pig.
Why not?
Let Tracy practice on me. And then at the time, Dr. DeGraff had the Q-switch.
The Q-switch laser, yes.
Had the Q-switch laser, and thing hurt like a mofo. Like we had to use injectable lidocaine, which to me was the best thing known to man because I couldn't feel anything.
Back in the day.
And that was Q-switch laser. So now you've been doing this a total of 6 years.
Yes, since I started there.
And you did get rid of 2 of my tattoos with the old laser. And then I came to you probably, 3 months ago now?
Yeah, it's been about
And I was like, got this huge tattoo on my arm about a month ago. I'm ready to get rid of it. Tracy was like, what? This is what I do, guys. I get tattoos and I'm like, hey,
Tracy will take it off. No big deal.
Let's remove this. And I was talking to you, and obviously Tracy's my friend, and she listens to me obsess. And I was texting her because I was watching TikTok videos, and I was just like, oh my God, this is just going to take forever. What do you mean you don't use injectable lidocaine anymore? Oh my God, how are we going to do this? And Tracy's like, would you calm down? We have a new laser. So let's talk about the new laser Advanced Life Clinic has.
So that's the PicoSure laser. It is, in my opinion, it is the gold standard, top of the line laser to use for tattoo removal. The difference, there's not a huge difference in as far as pulse wise goes with the Q switch and the Pico laser. The Pico laser works in a picosecond, which is like a trillionth of a second. So it's got shorter, quicker pulses.
So, I mean, it snaps faster, so it doesn't hurt as bad?
Yes,
okay,
exactly.
That makes sense.
So, and I'm not going to tell you the PicoSure is not painful.
It
still hurts.
It's painful. So
It's less painful than the Q switch, though.
Since I know about this, I get to tell you all my personal experience, and Tracy's going to chime in with her professional experience.
There you go.
So that's how this part of the interview is going to go.
All right.
So you said it snaps faster.
Yes.
And you can do more hits.
Yes. With the Q switch laser, it's a little more painful, if you can imagine.
I can attest.
And it takes a little bit longer. for me to go over the tattoo.
Is it just because the machine can't fire as fast as the other one? Because the other one is literally like...
Exactly. It is so fast. I only have to do one pass. I mean, it literally takes me seconds to like go over a tattoo. I mean, unless something's huge, I can do tattoos within just a couple of minutes.
Now, with this particular treatment, I know with the CoolSculpting, you can't really tell how many people, how many sessions, but with tattoos, can you look at it and say, I think you're going to need between 10 and 12 sessions, 8 and 10 sessions? Like, can you kind of estimate a little bit better for a tattoo removal?
It's a little bit harder. I'll tell you why, because everybody has a tattoo that's a different age, different amounts of exposure to the sun. Different tattoo artists go different depths in the skin. Some go lighter, some go harder. Not all tattoo artists use the same ink. So there's like a million different aspects to the tattoo.
Okay.
So, but what I can tell you is from experience, over doing it for 6 years, most people are going to fall between 4 and 8 sessions. Most people. I have done tattoos in 3 sessions. I have taken some that's taken more than 8 sessions. But most people somewhere between 4 and 8 sessions.
And is that, I know, like you just mentioned a lot of factors, and something I read up on, which we're going to set the record straight here on this podcast. Mm-hmm. The ink goes through your lymphatic system.
Yes.
Right. So, because everyone's always like, how is this tattoo removed? They think that the laser is actually removing the tattoo.
And laser does not remove it, actually. What it does is it breaks the ink up into dust-like particles, so that the laser, people also think it's heat, like a heat laser. What it actually is, it's pressure and energy. So that energy, it's such a quick change to the ink when it hits. That energy hits the ink. It causes it to just like almost explode, shatter. Yes, into little dust-like particles. When it does that, your lymphatic system sees that as foreign and flushes it out. When you first get a tattoo, if your body could, it would say, hey, that doesn't belong here, and it would absorb it immediately. But ink particles are too big for our body to do that, so it stays until we do this.
I don't know where I heard this, but this was like a long time ago when I was researching it. But they said like there will be some people, like when they get an autopsy later in life, that they, like when they're cut open, their lymph nodes will be like, instead of being like clear glandular like things, mm-hmm. they're going to be like full of ink. If you've had tattoo removal, I was like, that makes sense, because obviously
I can see that
you have lymph channels over so if y'all don't know, if this is a little bit too scientific or nerdy, like you have a lymphatic system in your body. That's how you detox. That's how you get rid of things. And it's very it's in between the skin. I'm just going to, don't quote me on this, but it's like in between, it's very superficial to the skin. And so, you can even go get lymphatic massages.
Yes.
And a lot of people do this after plastic surgery to get the edema and the swelling out. And, mm-hmm. it helps them depuff faster.
Yes.
And I would assume that's why so I'm getting this tattoo, like half my tattoo on my forearm off. Is that why it swells?
So you're asking why it swells, because of the tattoo removal?
Is it because that lymph, you know how, it causes, edema when you're, sick and stuff? I will be honest, I'm not sure about that. I do know that swelling is just because it's a response to the tattoo removal. Just, it's an inflammation. Yeah, that makes sense. I don't know what I was thinking.
No, that's a good question.
Your lymphatic system is for inflammation, so that makes sense. So, I don't know. Anyways.
I mean, that is, and talking about that, people ask me because, it takes most people 3 to 5 days to heal. People will call me. I've had people call and go, hey, it's been like a week and a half. I'm completely healed. Can we hit it again? But the lymphatic system, that's the reason I will not hit it again, because it is still flushing out. It takes a full 6 to 8 weeks. I prefer 8 weeks. You can do it in 6. I prefer a full 8 weeks to fully flush all that stuff out, because I don't want to fill your lymphatic system up again with a bunch more ink.
Well, not just that. I think that you're just wasting money at that point, because it's not going to. Your lymphatic system can only handle so much.
Exactly.
So sure, you could hit it again, but then you would just be taking people's money at that point.
I'm
and
not
you're
gonna do that.
Good, kind person.
No, I would never do that.
No, that makes sense, because it takes a long time to, if you think about anything like a sprained ankle.
Yeah.
It's kind of similar to that. Like if you've ever rolled your ankle, sprained your ankle, it swells up on you. It hurts for a good solid 4 to 6 weeks, because your body, your inflammatory process is going through all the cytokines, all that, if you want to get into the nerdy part of it, until it can heal.
Right.
So that makes sense. Now, is there anything like before or after care someone shouldn't do before a tattoo removal, or what they should do after?
Before care, I mean, there's not anything big. I mean, I would tell people, not that people are going to do this part, but I tell people, if you have alcohol before, you're taking blood thinners, that can increase your risk of bruising. I mean, it's not going to stop it from working or anything, but you just can increase that risk. Aftercare, though, I'm going to tell you to keep either a triple antibiotic ointment on it or Aquaphor, either one. Keep that on there and keep it covered, and change that dressing at least twice a day. No standing water, no pools, hot tubs, showers are fine, but nothing where there's any standing water, just because we carry bacteria on our skin. And your skin's not going to bleed when I do the tattoo removal, but it does cause these microscopic little cuts. And if we're scratching or we're putting it into something where there's bacteria sitting, it can get into that and cause a skin infection. So I tell people, as long as you keep it clean and keep it covered, you're going to be fine.
So basically treat it like a wound.
Yeah,
is
pretty
what you're
much.
saying.
Absolutely.
I also keep mine out of the sun.
Yes, you should. You should. And
I just noticed, like, if I go out with my dog and I don't have it covered after I get it lasered,
yes,
like maybe, like even probably up to a week after it's lasered, like the sun just makes it feel painful.
It does. Well, I mean, any laser is going to make your skin more sensitive to the sun, so that's absolutely true.
And then after about a week, the redness goes away on mine. I stay a little bit red longer because I just, my pale skin, that's just anything. Like, it just stays for about a week, and it'll be a little red, and after that, I'll just put sunscreen on it.
Yeah. I would always recommend, like, once it's healed, to keep sunscreen over the area.
Now, things I do, but I know are not necessarily aftercare instructions, just something that I do because I'm just really into biohacking and nerd out. Well, maybe TikTok, too many laser tattoo removals. But I do a sauna blanket, what I was doing anyways for my inflammation. If you've listened to this podcast, you've listened to me here, or you've heard me say it about my thyroid. Like, I've been sitting in my sauna blanket, which makes me sweat a lot, which clearly is clearing out and detoxing your lymphatic system.
Yes,
so
absolutely.
I feel like since I've been doing that, because I've only been doing it for about a month, my ink started going away more.
I think anything you can do to flush out your lymphatic system is going to help that, because
like a lymphatic massage, and you can do that at home.
Extra water, all those things. And, just to throw it back in there, people ask, is there anything I can do after CoolSculpting? There's nothing you have to do, but drinking more water, getting that lymphatic system going.
When you said that earlier with the CoolSculpting, about it goes through your lymphatic system too. So anything helps.
Yes.
Just clear that faster so that you heal a little bit faster, better, maybe.
It's like, do you have to do that? No, but it would certainly. I feel like it would help. Absolutely.
You might see results maybe a little bit quicker.
I would think so. I prefer 8 weeks because I do feel like, I know it's only a couple more weeks, but I like to give it the full amount of time to see full fading, to make sure it's healed well. And not only that, when it comes to pricing on these, we price it per square inch. It's $100 per square inch. Let's say we're doing a tattoo that costs $500. Well, we might treat it a few times and I see less ink. Well, I want to wait that full 8 weeks to see the full fading. So when you come back, so I can go down on that price for you. I'm going to reprice it. We're not going to charge you $500 worth of ink if we're only doing $200 worth.
That makes sense. I like that y'all do that. Because I was going to a clinic before we started practicing on mine, and they charged, oh my God. It was a package session. So you either had like a small, medium, large, or extra large, I think. And you had to fit within these parameters. And my tattoo that we started on was not very large.
No,
it was just small on my wrist. It was $500. No, maybe $500 or $600 for like 3 or 4 sessions. And I was just like, it was small. Like, probably by y'all's pricing, I would have paid maybe $100 a session.
Right.
And then again, I think I maybe bought 2 of those packages, and it did not fade not one time.
And you have to have, it's not just we were talking about this earlier. It's not just about the tattoo machine that you have, which again, I think PicoSure is top of the line. It's also about the technician you have. If you don't know what you're doing, you can absolutely undertreat, overtreat, hurt someone with it.
Well, that makes sense, because they did have the PicoSure at the time. And I don't know this technician. I mean, she was a very sweet nurse, but again, I think I did 6 or 8 sessions, I can't remember, and it did not fade one time with the PicoSure laser. I switched to y'all with the Q switch.
Right.
And it was almost like you just knew how aggressive to be without being too aggressive. So and that makes sense that the laser technician, obviously you're the one operating. Like, how close are you to the skin? How far away are you from the skin? Are you, like you said, over treating or under treating?
And you can do those. You can burn somebody. You can under treat and you're not going to see anything. I mean, there's a lot to it. So you do have to know how to use your machine, but
and that just comes obviously with experience and training.
It does.
So I like that about you. And I mean, I praise you to anyone like that I see on social media or something being like, anyone know anything about tattoo? I'm like, yes, go to Tracy. She's been the best one that I've had best results with, and they're very good priced, I feel like, on.
Thank you. I try to be very fair with pricing. Like I said, I'm not going to overcharge you for something. And I do also offer something like, some tattoos, people come in with, fairly big ones, and we're getting up into, if I charge them per square inch, we would be in the thousands of dollars. I will cap it. I'm not going to make anybody pay.
Is that when you kind of do like an extra large package tattoo?
Yes.
Yeah, that makes sense.
So the most I'm ever going to, I mean, and this is barring somebody come in with a whole body, so please don't quote me on that. I'm talking like you've just got like a big back tattoo or something. I'm probably going to cap that at about $800. And then I offer this. You can pay as you go. You can come in once every 8 weeks, pay as you go. Also offer a buy two, get one free.
Yeah.
You just have to pay that up front. On the day of your appointment, if you want to pay $1,600, your third one's free.
Which that's still a steal.
I think so. I mean,
yeah.
Or if you don't want to pay that much up front, which I get, I wouldn't, I don't have that to pay up front. You can pay as you go.
And people don't, so also, even though we say 6 to 8 weeks, you don't have to.
No.
You can go 12, 14, 16, and sometimes
absolutely.
Time is your friend.
Absolutely. It's going to do nothing but keep fading. So if you said, hey, Tracy, I'm not going to be able to see you, I'm out of town, or for financial reasons, work reasons, whatever, I'm not see you for 6 months. It's not going to hurt anything. Your tattoo is going to fade to a certain point, and it's going to stay there until you come back.
Well, my wrist tattoo that we did, I remember we got it down really light, like you couldn't even see it. My watch covered it.
Right.
And I remember we stopped because I was like, that's good enough for me. And then now, like, because now it's been 4 or 5 years.
Yeah, it's been a
5
while,
years.
Yeah.
It's completely gone. And I remember when we started on this one, I was like, Tracy, look. I was like, this one's like, because sometimes time is your friend.
Yeah, it's just going to keep fading. The worst thing that's going to happen is it's just going to stop fading and just sit there until you come back. That's it.
Right. And then, so we talked about pricing a little bit. You said $100 per square inch, and then kind of cap it at a big one. But the most question for the tattoo removal was, everyone sent me this, how painful is it?
That's a really awesome question. It does hurt. I'm not going to lie to you. I've been told, I don't have a tattoo because
She's never had one removed.
I'm a big baby. I have put the machine on my hand just
but
to
it's
see
not
it's
ink.
not the
It's
same.
not the same.
It does hurt. But I can tell you through years of experience, I've been told 2 things. I've been told it either feels like getting a tattoo, which for some people is not bad. I mean, I'm not going to say it's painless, but it's not the most horrible thing. And the other people tell me it hurts way worse than getting a tattoo. So those are your 2 options. It hurts or it really hurts.
And I will speak from a person who's gotten a removal, and I think I have a pretty good pain tolerance.
Yeah, absolutely.
It fucking hurts.
It does so bad.
But okay, and I have also so I've had 3 different techniques so with the other, they use topical lidocaine, which did not even help. When people even ask for that, guys, I've had topical lidocaine. It doesn't even change the pain level.
No.
You're just wasting time. Second time with the Q switch that Dr. DeGraff used to offer, injectable lidocaine, couldn't feel a thing.
No.
Could be bad, could be a bad thing, could be a good thing, because again, you don't know how hot it's getting on your skin. Pain can sometimes be a good thing. Like now with this one, we don't use anything.
No.
I may have a glass of wine before I come. That is not something I'm telling anyone to do, but that might be what I do for my anxiety.
You wouldn't be the only one.
It is not something that I obviously couldn't do. I've had 2 tattoos removed.
Right.
I'm getting a 3rd removed. And clearly I'm coming back. So it's not something that's unbearable. But for me, the way I would describe it, have you ever been popped with a thin rubber band?
Yeah, that hurts.
Okay, multiple times, over and over and over. Someone's just going pop, 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 pop.
Hurt.
But it's not. It's not like you're sitting there doing it for 20 minutes.
No. That's the thing. It hurts, but it's so quick.
It's so quick,
and we take lots of breaks.
And what I do, I make Tracy talk to me. I'm like, just talk. And then in my head, I'm just going 1, 2, 3.
I use so many different techniques to get through it. I tell people this, just bottom line, I have never had anybody nope out of it. I've never had anybody, and I'm talking, I've done from the face all down to the feet. If you name it, I've probably taken a tattoo off just about everywhere. And I've never had anybody say, I can't do this. I've had people say, I need to take a break, and we've taken lots of breaks. You can get through it.
And if you have a large one, because the one on my arm is probably the biggest one I've had removed.
Yeah.
It does a little bit start going numb.
Yeah.
Like a little bit, like halfway through, I'm like, okay, this is getting a little bit less intense.
I've had people say that. I mean, and I use different techniques. For some people, they're like you. They're like, just do it. Don't stop. Do it as quick as you can. Talk to me. Let's get this through. I have some people that I literally will do a 5-second count. And I'm like, look, I'm going to count to 5. And when I'm at 5, I'm going to stop. You don't even have to ask. So mentally, they're like, I can do 5 seconds. So I'll count to 5 and we stop. And when they're ready, they say, okay, go again. And we count to 5 and stop.
We tried that the first time on mine. And I think for me, the fear of starting again, it's just like, no, just go.
And some people are like that. Go. Some people are like, don't stop. Just please, do it until, and we do that. And some people are like, you just do it until I tell you to stop. So everybody's got their technique that they use, but it's
I will say, I know because where this one that you're removing on my arm, like it's half on the back of my wrist and then on the forearm and then some in the AC area where you would get an IV. Different areas on the body, obviously skin is thinner or thicker in areas. And I will say, because I've had one on my wrist on the other arm, the wrist, which I couldn't feel because it was injected with lidocaine, but on this arm, the top of the forearm is the least painful. The back of the closest to the hand and in the AC area is like, whoo, that is some spicy.
You're right though. There's different areas that will hurt that I've seen hurt just worse.
What do you see like the most? Like, is it more the extremities, back, chest? Like, where would you say hurts the most probably?
Oh, face.
Well, I got my eyebrows done and it didn't hurt that bad.
I'm talking like these are big tattoos all over the face.
Gotcha. That makes sense.
Yeah.
Okay. So,
but you're right. Those sensitive areas. Yeah. Like you think the inside of your arm, I mean, that's going to hurt doing anything, or maybe like your calf, like the back of your leg or something.
I couldn't think about my foot. If I had one on my foot, it would just have to stay there.
Yeah. Or your neck or someplace that's really sensitive. Yeah. So, yeah.
Now, why do you not use the lidocaine anymore? Why is that something because I remember when I came to you and I was like, so we're going to do the lidocaine, right? You were like, no, we don't do that anymore. I was like, oh, what?
So there's a couple of different reasons we don't use topical lidocaine or injectable lidocaine. Topical lidocaine, it can cause some swelling, some soft swelling, which is going to reduce the efficacy of the laser treatment going into the skin. Beyond that, it just doesn't work very well. It's only numbing that top layer of skin.
It doesn't work at all.
No, I mean, the laser is going deep below that top layer, so it's not really doing much. And we don't want to make you pay for something that's not working.
Right.
Injectable lidocaine, it just reduces, again, the efficacy of the treatment. It's putting a barrier between that laser and where we're trying to
Is that because lidocaine, like you said, it makes it swell, so then the skin is a little bit away from the ink?
Yes. Okay. And the laser doesn't get there as well. And I've had people come in, I don't know where they got it. They did it on their own, but they're like, I had it injected before I came to you. And I'm like, okay, as long as you know, we're going to spend way longer doing this. And they're like, I don't care. We're doing it. So I don't inject anymore.
And I will say, like, if you are afraid of the pain and you don't care to pay for maybe 3 to 4 more sessions.
Yeah.
Do what you do, boo.
I'm saying, but I would rather, that's the thing. Everybody can make it through it. I would rather get it done quicker because getting a tattoo off is going to take longer and cost more than it ever did to get it put on. So I say, let's get this done quick. And that's what I do. I'm as aggressive as I can be every treatment. I take pictures before every treatment so we can look at this together. Because I've had people go, I don't think it's faded that much. And again, we look at pictures and we're like, oh, wow, I didn't realize it was that dark to start with. Can I take a picture of that?
Now, I know when I first did tattoo removal, this was something like, because it does the little it turns it white, like the ink.
It frosted. Yeah.
So I thought
it was gone.
Yeah, I was like, oh my god, it's gone.
Everybody does it. I'm like, no, that's a trick of the laser. It will turn back.
And I think that's why the misconception happens where people are like, the laser's removing the tattoo, because you see that frosting, like if you're watching,
and then you're like,
you're like, oh my gosh, it's gone.
I have to warn my first timers. I'm like, it's going to turn white. It will turn back black or whatever color it was when we're done. It's not permanent.
Is there easier ink to remove? Like, what's the easiest ink? I know you were talking earlier when we were talking, you said you couldn't really say session wise because of all the factors such as like ink depth and stuff like that. What have you seen the easiest black, green, red, purple? Like, what would you say, color tattoos versus black and white tattoos?
I would say the darker the tattoo, the easier it is. Black, blood red. Oddly enough, normally I would say greens is going to be hard. With this Pico laser, I have seen greens fade quicker than anything. I don't know what it is, but just that one color. But the darker the color. Now, when you can start getting into pastels, like yellow is, it's hard. It's hard. It will fade it. I don't know if it'll ever be completely gone.
That's so crazy, though. You would think like a black or ink would be harder.
Well, think about the way I describe it to my patients is if you think about a black car and a white car sitting in the sun, that black car is going to get harder and absorb that sun easier than that white car. Same with an ink. It's just not going to absorb it very well because the laser is picking up on pigment. And if it's really light and there's not a lot of pigment there, it's just
I
not
like that analogy.
Pick up on it.
Yeah.
So when you got pinks and yellows and very pastel colors, those do take longer.
Has anyone ever came in? You know, the trend started coming out with white tattoos because people wanted tattoos. You can't at all?
Not at all.
Oh,
it won't.
wow.
There's no pigment there.
That makes sense. But oh wow, what if someone's like, oh, this is just real? Like, I mean,
luckily
clearly you
it's
can't.
white,
Right, you can't see it.
Yeah. Same, and that's back to the yellow. Yellow is such a. I know it's not a skin color, but it's so light that we can fade it. But by the time we're done, you can't really see it.
I was about to say, people would probably, like, if you got up close to them without all the other colors around it, would probably go, is that a bruise?
That's what I'm saying. Yeah, you can't really see it. It's not a big deal.
Now, I've also heard, like, depending on where the tattoo is on the body, it could also take a little bit longer to go away. Where would they be located on the body for them to, like, have lesser sessions, if you would? I know there's other factors, but, like,
what would take the longest? What would take the least?
Yeah.
So just from me doing it over the past 6 years, I have found that finger tattoos tend to take longer than anywhere else on the body.
That makes sense because the research I did was extremities take longer because they're farther from the heart.
Right.
If you think about all your lymph nodes, like axilla, groin, like all your big lymph nodes are on the core of your body, not on the extremity of your body.
So finger tattoos, I mean, other places, I mean, most tend to go away pretty well, but those, and don't be wrong, you have the exceptions. I've had people come in and only need a few, and I'm like, wow, that's awesome.
Mm-hmm.
But I warn people with finger tattoos, I'm like, these tend to take a while.
Now, do you think home tattoos or gel tattoos, because they're done so poorly with, like, it doesn't tend to go as deep because they're faded?
Those are my favorites.
I was about to say, I think they come off the easiest, don't they? Like the little home tattoos?
Yes, because when you're doing it by hand, you don't tend to go as deep as a tattoo gun would. So it doesn't have to go as far to break that up and get rid of it. Those usually come off way quicker than a professional tattoo. So I know people think I'm judging when I see somebody come in and it's not the best tattoo. I'm like, was this like a professional tattoo or done at home? And they're like, it was professional. It's done by a gun. I'm like, okay, that's not it. I'm asking. I'm kind of hoping it was done, or if they go, well, it was we call them stick and poke.
Yeah.
I'm like, that's not a bad thing. I'm not judging.
Because they don't go as deep.
No. And I get excited. I'm like, great, this is not going to take us as long.
Now, what's the longest tattoo session you have done?
Like while they were there at that time?
Yeah.
I have had somebody take me about an hour and a half.
Ooh.
Because we were taking
breaks.
And it was such a big tattoo, and it was so dark and it was so painful that we had to take that many breaks. So for this person, I would always put about an hour and a half. It's almost gone now. The person I'm talking about.
That has to be like very self-satisfying to be like, this is almost gone.
I wish I could show you. I wish I had the pictures here to show you, but his was covered most of his chest and abdomen, and I think it's one of the pictures we use on our website.
Oh, okay, yeah.
If you've seen that,
I have seen that one. Yeah.
I actually saw him the other day, and he showed me it's faded even more than what the picture on the website shows. It's almost gone. There's got a couple little spots of ink left, and that's it.
Now, with the tattoo removal, is there such thing as like a good or a bad candidate? Like, can you not remove some tattoos?
Here, the only way I would say somebody's not, or I wouldn't say somebody's not a good candidate. Mm-hmm. But the darker the skin tone, I do warn against it. You are more likely to have hyper or hypopigmentation with darker skin tone.
Okay.
So it's not that I can't remove it. But for example, I've got one patient comes to mind in particular where I'm removing a tattoo, and it's a ring tattoo, and the skin there is significantly lighter than the surrounding skin.
Right.
So, and I've had another patient who it was darker skin than it made it look even darker than what it was.
Because I was going to ask you that, like, can you scar? Can you blister? Are you going to have this white outline when you're done where the ink used to be?
Right. Those are great questions. So everybody can be prone to hypopigmentation. I have no idea who's going to and who isn't. On lighter skin tones, more than likely that will correct itself and it fades.
Mine did. Mine was a little bit lighter, but then it went completely away.
Right. And some people, do the opposite. They'll have, it looks like the tattoo's still there, but it's just hyperpigmentation. It does fade. On darker skin tones, however, it can fix itself. I can't promise that, though, because lasers are meant to pick up on pigment and break that pigment up. And that's exactly what it's doing. It doesn't care that it's melanin or tattoo ink.
And we can say that because, y'all, let me tell y'all, we did my eyebrows as well because Kayla's going to correct them. Kayla's actually going to be on the podcast talking about tattooing. This is the opposite of removal. Right. But we removed my microbladed eyebrows because, guys, no matter what the wording is, microblading is a tattoo. It is someone cutting your skin, putting ink in.
Right.
And if you have a bad outcome, like they say there's all these procedures like microblading's supposed to fade, which it is if you don't go too deep.
Right.
Mine wasn't fading, so I didn't really have a choice at this point because like we did everything to try to fade them, chemical peel, everything. And we finally just out at my second session for my arm removal, I was like, let's just get these eyebrows off, let Kayla fix them. And I was scared, but like you said about hitting pigment, so I have red eyebrows. And I remember, so guys, seriously, I have to wear mascara. If I don't, people are always saying, what's wrong with you? Do you feel okay?
Are you sick today?
I have blonde eyelashes and basically strawberry blonde eyebrows. So I have to dye
nothing.
I look like I have nothing if I don't put anything on them. So as I got older, I knew that there was like eyebrow tint. So I started tinting my eyebrows so it looked like I had some eyebrows.
Right.
Because I used to really think that I didn't have any, and that's why I got microblading. But then I was like, oh, you can actually tint your eyebrows? Go figure. Anyways. And I have to wear mascara for my eyelashes. Well, for this session, you had to put these little sticky things on my eyes. So I was like, well, I'm not going to go in there with mascara because it's just going to pull all the mascara off.
Right.
And you even warned me, you said, Jonna, the laser's going to hit the ink, but it's going to hit some of the eyebrow too, and it's going to turn the hair white. It's going to look like you don't have any eyebrows.
But it's not permanent, though.
It's not permanent. But I sat up and looked at the mirror. Also, guys, but I had a headband on with my hair pulled back. So imagine what I'd look like. I could not stop laughing. I was like, I looked like I literally just walked out of chemo. That's what I looked like. That is what I looked like. And I could not stop laughing. And I kept asking you, how long is this going to last? Because I had no pigment. Like I had white eyebrows. So
how
now
long did it take? Because that's the thing. People go home. I know it's not permanent, but I don't go home.
It's not permanent, but like I still have some of the tips that are still
it grows out.
It grows out. So like I also have hypothyroidism where my hair doesn't grow as fast as it should.
Same.
But needless to say, I just dyed those bitches 2 days later. Just when you told me you were like 48 hours, Jonna, just 48 hours.
I know. I'm like, please don't put anything on them for just a couple of days.
So I was like, okay, I'll wait 48 hours and then I'm tinting these bad bitches. And it was all well in the world.
Yeah, there you go.
But then we just hit them again because it turned red underneath the eyebrow ink.
So the reason it did that is that cosmetic ink is not the same as the ink used in the rest of our body. So the reason I tell people this when you come in to have your eyebrows lasered off, it can turn red. Not everybody's does, but it can because some ink has, iron oxide. I think it's in the ink, which, you think it turns like a rust color red. And that's what it did. So we do have a different handpiece that targets reds, oranges, pinks. So Jonna came back in and after 8 weeks, we let everything fade and we hit it with a different tattoo, the 532 handpiece, and just to fade that red out a little bit more. So,
and I think that was 2 days ago.
Yeah, it's just a couple of days and they look great.
They're great. So I already sent a picture to Kayla and Kayla was like, yep, you can go ahead and book. You have to book 6 weeks after your treatment. So I went ahead and booked 8 weeks just because now I'm stuck with 8 from you. Like 8's in my head now.
To me, it's like, let's give it as much time to heal and get the best. I mean.
Yeah, so we're going to fix these puppies in 8 weeks. So August 22nd, I think is when we're going to fix them. But you even said like most eyebrows 1 to 2 sessions.
1 to 2 sessions. Usually that second session is because somebody's has turned a little more reddish or pink color after. But yeah, 1 to 2 sessions at most.
Now, do you see where you have to do 2 sessions on the rust color or no, not really?
Usually not. I mean, I think in the whole time I've been doing this, I think I may have treated a third time once or twice. And it's only because somebody was being very like picky about, hey, I still see a little bit. And here's the thing. yes, there have been people who've come back, and the most I could get it faded was a super, super light pink color, almost like the pink of a scar. And I'm not talking about anything that you would have to really stare
Like
at
you could
them.
put concealer over it.
Oh, absolutely.
Okay, yeah.
Makeup would cover it up. And even without makeup, it's not noticeable unless you were really staring at them. So
Not
most
really.
people, no, not really. I mean, and that was just somebody like, we're on Worst Critics. She's looking in the mirror up close.
Right.
She's like, I see a little bit of pink. And I'm like, it's just there.
Now, with the scarring, I do want to kind of touch on this real quick on how important, again, I know we said this earlier, how important your technician is, because the scarring comes from the overtraining, right?
It can, but it can come from a couple of different things.
Oh, yeah, people picking at it.
People can
'Cause I've
pick at
done
it.
that.
It can scab over. Not everybody will, but it can scab over. You can have blistering, and blistering is normal. The darker
Just
it
don't
is, it
pick
has
at the
nothing.
blisters.
Yeah, don't peel the skin off. Picking at it can cause scarring. But not only that, and now if someone is prone to keloid scarring, it can cause that. So I'd say on average, no, it's not going to scar, but I can't promise that it won't. I mean, sometimes it happens. Sometimes we do our best care and you may have some slight scarring, but unless you're prone to keloid scarring, any scar that it does cause is going to be very minor. And usually that doesn't happen.
Yeah, mine wasn't. Like, even the one where it was, I think, now that I think about it, I think I actually picked at that one too because it blistered.
And people do. I mean, I do that. If I'm like absentmindedly, if I touch my arm and there's like a little scab there, I'll pick at it, not thinking about it. And I have to tell people, please don't do that. That can cause scarring, and there's nothing I can do about that.
Right. That's not something you can do. And it wasn't your fault.
No,
it was
like,
mine
please
because I'm a picker, now that I think about it. I think that is all the questions I have. Is there anything at all that you can think, CoolSculpting or tattoo removal, that you are just like want to hone in or repeat, or something we haven't said?
I feel like we covered everything.
I mean,
you asked some really great questions, or whoever sent the questions in asked some really great questions. I just want to, reiterate that consults are free for no matter what we do there. So if you're interested in anything we've talked about, come in, talk to me. If sometimes with tattoo, we can treat on the same day with tattoo, just depending on how big it is. But at the very least, consults are free.
Right. I mean, what's the worst that anyone could say?
Right. You walk out and you decide not to do it. That's fine. No big deal.
Agreed. Oh, wow. The lights just blinked. I was like, what was that? The lights just blinked. Can we do like a code for listeners for either tattoo removal or something at the clinic?
So for tattoo removal right now, I know some people have been coming to get their eyebrows done. They're wanting to have them redone. They may not like them. So if you mention Jonna from the podcast here, or Kayla, who is
the brow bar.
The brow bar, yes, in Providence, right?
Yeah.
Is that what she said? If you mention Jonna or Kayla when you're getting your eyebrows done, we will give you 25% off your treatment.
And that is a steal, guys. The eyebrows are super easy. They're not that expensive. I think it's like
$100 normally.
Yeah.
We'll do it for $75
See?
if you mention those names.
Mention me or Kayla. Just go in and say Jonna or Kayla. If you say Babbles, they'll know what you're talking about as well.
Absolutely.
I know that's what I said on my stories one time. Just say that to Tracy, but you have to ask for Tracy to get that discount.
Yes.
So that's why we're having her on the podcast. But I want to shout you out again, Tracy. Y'all all go to Advanced Life Clinic online. You can follow them on social. You can also go to their website, advancedlifeclinic.com. And Tracy is on the story sometimes. She's going to start posting more.
Yes,
I'm trying to make her post
am.
more about CoolSculpting and laser tattoo removal, because I think there are gems that people don't think about. I think people think that they have to live with something.
Some people don't know that it's out there.
Right. Well, not even just that. I think that there's a judgment a little bit, because I know I've gotten tattoos, and then I'm maybe in a different stage of my life, and I'm just like, I don't really care for these anymore. And if I had the time and the money, and the resources to do it, I'm going to remove it. And people have looked at me going, oh my God, why would you do that? And I'm like, why would I not?
Now, let me tell you that.
Why would I not?
That's the number one reason people get tattoos removed, because I'm nosy. I will always ask. And you don't have to tell me if you come in.
I don't think that's nosy. I think that's just making conversation.
But I will ask. I'm like, so why are you getting this removed? And the number one reason people tell me is I was young when I got this, and it is not who I am anymore. And that's fair. We're not the same person at 18 as we are at 35 or whatever age.
Right.
So it's fair to, you get it and you go, that's not me anymore. I want this removed.
Or trends.
Yeah.
You did it because it was a trend. Like the finger tattoos were a trend.
Do you know how many tramp stamps I've taken off?
Right.
Not that those are bad. I'm not saying.
It was
I'm
just
just
a trend.
saying it was a trend.
When I was 16, yeah.
people come and they're like, hey, I've got kids and that's not something that's in my lifestyle anymore. It's not bad. It's just not
I
for
think
them.
it's because at the time that people were getting them, they weren't called tramp stamps. And then all of a sudden.
And I say that jokingly. Please don't. I'm like, y'all please don't think
I'm just saying like 2 or 3 years later, people are like, oh, if you have a back tattoo, it's a tramp stamp.
Right.
And the stigma, trust me, if I had one, I'd be like, hey, we're moving this.
Right. A funny story for later.
Okay. Well, sidebar when the podcast is done. So guys, again, if you want to mention John or Kayla at Advanced Life Clinic, ask for Tracy, schedule your tattoo removal appointment. That does not go for CoolSculpting. You'll have to listen out for their specials, which again, April and November are their open houses.
Yep.
And then if you follow them online, you'll see when their CoolSculpting events
Absolutely.
are. And then we're going to make Tracy post more.
Yes,
so y'all can see all the fabulous work she's doing there.
I'm going to do that more.
If you go in for a consult, she obviously has before and afters there that she can show you.
Absolutely.
But I'm going to start making her post them more because she's doing fabulous work. She's got to post it.
They really are. It really is great on both CoolSculpting and tattoo removal. I mean, insane results from it. So
that's good. Well, all right, guys. I hope you enjoyed this podcast and forgive me for being a little rusty. I don't think I've interviewed anyone in like 3 months.
Well, thank you for having me. This was fun.
Absolutely. And you were nervous.
I was nervous, but I'm not. You made it great. I mean, it was
good.
very comfortable.
All right, guys. Until next time. Bye.